So surgical abortion is doing a termination of pregnancy by means of an operation. And the operation really is quite simple because you don't have any cuts in the abdomen or anything. We go through the uterus, through the cervix, the neck of the womb, into the uterus, and we use very flexible suction cannulas, which has been made safe by design in the past 20 years. And even suction, we don't use mechanical suction anymore. We use manual suction, and that's why we call it manual vacuum aspiration. Much safer than 20 years ago, less chances of perforation of the uterus, less chances of bowel injury, which is a problem we used to have in the past. And surgical abortion can be done again anytime after the missed periods and up to 24 weeks of pregnancy as the British law allows. So surgical abortion can be done either under local anesthesia while you are awake or under conscious sedation or general anesthesia, which means you are asleep, you don't feel anything at all. Now, surprisingly, 90% of patients choose surgical abortion under local anesthesia because it allows them to walk out fairly quickly and even go back to work after 1 hour or so. Especially if it is done between 4 weeks to 9 or 10 weeks, you only feel pain during the suction procedure, which is similar to bad period pain, for about 15 seconds, and that is repeated about 3 or maximum 4 times. So it's period pain. Well, let's assume it's labor pain, and if you are able to put up with labor pain for 15 seconds 4 times, then this is not a bad choice because there is no sedation, and as I said, you feel really well after that and you can go back to normal activity straight away. After surgical abortion, you really expect to have period-like bleeding, like a moderate bleeding, like at the end of a period for up to about 7 days. You only just have to avoid intercourse and the use of tampons for about a week. But most people can go back to work almost the following day. So side effects of surgical abortions, like many other operations, have side effects, and similar to medical abortion, heavy bleeding can happen during and after the operations, just simply because of accumulation of clots. Occasionally, some small pieces of placenta still stay in the uterus or remain stuck. Although we tend to use ultrasound to make sure that the uterus is completely empty, but still, despite that, 3% of people come back for repeat curettage because of retained tissue. So following medical or surgical abortions, you expect your periods to go back to normal within about 6 weeks to 12 weeks, and after which really you can try for a pregnancy if the circumstances have changed.